Death of an individual has sustained either by irreversible cessation of respiratory and circulatory system or irreversible cessation of all the functions of the brain and including the brain stem. The physician certifies the death in the medical records and record the date and time of the death. We can help the relatives to see the patient and be with the patient throughout the procedure and help the patient's relative as much as you can. As soon as the death is pronounced, we have to make the alignment of the body. We have to remove all the tubings and extra devices whichever applied to the patient, and we have to remove all the valuables from the patient and hand over it to the family members or the relatives in the presence of the co-worker and get it signed in the register. We have to remove any extra pillows. Only one pillow can be left under the head of the patient. We have to close the eyes of the patient and close the jaw. We have to remove all the extra tubings which are applied to the patient. We have to make the patient as natural and beautiful as we can. We have to provide the mouth care and bed bath before packing of a body. Articles required for care of dead body includes the mouth care tray with the feeding cup, plain water and KMNO4 solution, kidney tray and paper bag, gauze pieces, dressing set, swab sticks, Macintosh with lining and mouth gag. Articles which we require for care of dead body including bed bath tray which includes Macintosh with lining, bath towel, face towel, clean clothes, 2 dusters, soap, pint measure, jug with hot and cold water, basin. Extra articles which we requires pair of gloves, mask, kidney tray, paper bag, 2 identification tags according to the agency policy, bandages and extra dressing pad. Wash hands and wear gloves and mask. We have to give then mouth care to the patient. After the mouth care, we have to give bed bath to the patient with the bed bath articles and provide the clean clothes to the patient. After the bed bath, we have to close all the orifices of the patient. We have to close the nostrils, we have to close the ear, and apply the bandage over the jaw. Then we have to tie the hands of the patient. Tie the toes. Provide the perineal pad in cases of the female and plug the anal opening also. After closing of all the orifices, we have to apply a label. One on the chest of the patient. Then wrap the body from the foot end to the head end and from side to side. Then tie the sheet with the adhesives, or you can use the bandage. We have to tie the body from the foot end to the head end. Lastly, the head. And apply the another identification tag on top of this shroud. Hand over the patient's body to the relatives or family members and shift it to the mortuary. Documentation has to be done in admission register, discharge register, death register, treatment register and report book. Document date and time of the death and cause of death. Document description of all the therapies and procedures that has done.